Hello, I am Dr. Malikarjun, intensive care specialist and anesthetist. I have done previously also, I have done so many videos. Today I want to talk about an important topic called status asthmaticus. Status asthmaticus. What is status asthmaticus? Actually, we all know about asthma. Asthma is a condition where you develop to some allergy, some dust or whatever it is, pollen, dust, dew, whatever it is. You develop some type of breathlessness with wheeze, and this is called asthma. But here in this condition, in status asthmaticus, the problem doesn't end there. Once the asthma comes, it doesn't subside with anything. It goes on for a period of say 2 to 3 hours, 3 to 4 hours, sometimes a day, two, like that. The patient suffers continuously and ultimately he lands in hospital. And in hospital, we put them on oxygen and some bigger injections like adrenaline and solumedrol, which are life-saving medicines. And sometimes the patient may need ventilator also. Of course, rarely the patient may need ventilator. Today morning I have seen two patients. One we could treat. Both patients had this status asthma, continuous asthma for the last one day. For yesterday night they had the problem. One patient was okay with oxygen, he settled down, and injections, he settled down. The other patient, the second patient, needed ventilator. Definitely, even though we kept him on ventilator, he also will come back, and by evening or by tomorrow morning he will be normal. Don't bother about that. This is simple. But please don't land in such conditions. Always this status asthmaticus, what we feel is, what we have seen is, only people who don't use regular treatment for asthma, for example inhaler, they are not using regularly inhaler, they just ignore the inhaler, they don't use the medication properly. Sometimes they go to some marriage, they don't carry it. Only at that time they are landing in such problems. People who are on regular medication like inhalers and all, suppose somebody uses inhaler daily, morning and evening, they never land in this problem. So be careful about that. And wherever there is an asthma patient inside your house, there is an asthma patient in your home, always be careful. If the asthma is recurring frequently, see twice in a week or once in a week, if the asthma is recurring, it is always better to carry a pulse oximeter at home. Pulse oximeter, we used to have in COVID, a small thing which shows the oxygen and heart rate. It is very, very important. It is called pulse oximeter. And number two, inhaler, of course, the patient will be using. And another machine is nebulization machine, small machine, nebulizer. It's called nebulization machine. Every medical shop it is available, very cheap also. In that, we use two drugs. For the nebulization, we use two drugs. One is Livolin and the other is Budecort. One is Livolin and the other is Budecort. So two things, mainly two drugs we use. One is, this is bronchodilator, it dilates the bronchi, and this is a steroid. These two things mixed with saline we put in the chamber. So this gives faster relief. So these things are used. Pulse oximeter is a must, inhaler is using, nebulizer you must have. In spite of all the things, if it is not coming down and the patient is definitely still having asthma and not coming down, please come to the hospital. He may need oxygen immediately. So one more thing is in chronic patients who are chronic sufferers, it is better you have an oxygen cylinder at home, or during COVID, most of the people have purchased oxygenators, small machine which generates oxygen with electricity. It generates oxygen. Such things are life-saving at home. These are compulsory. But in spite of all the things, if the pulse oximeter is showing low oxygen, 90, 91 like that, immediately you have to come to the hospital. You can get treated. Treatment is simple, but the only thing, how early you come to the hospital is important. So I wanted to just say that asthma is not a simple problem. Sometimes it can turn into status asthmaticus, which is life-threatening. But In the hospital, it is safe. I am saying at home. At home, it can be dangerous. In the hospital, it is a simple problem. We daily deal with this problem. Be careful and don't take asthma lightly. Always carry your inhaler. Almost regularly, you must have an inhaler with you in your bag, because as and when you suspect, immediately you should have. And when the dust is there, just 1 or 2 puffs of inhaler will do the job. See, be careful about this. Don't land in this big problem.